As technology gets more advanced, researchers are finding new ways to combine it with traditional medicine and make everybody healthier. That's what just happened at Scripps Research in La Jolla. I spoke with the author of a study about a better way to predict and prevent the #1 killer in America, heart disease.
Describes how we divvied up the data.
Scripps Research professor Ali Torkamani is a doctor, but not in the medical sense.
I am a computational biologist.
That means he uses data, computers, tech to make healthcare better.
I use a combination of computer science and sort of biology to do my work.
And for the last few years, his work has focused on heart disease, the leading cause of death in the U.S.
It's a very complex disease in terms of the factors that can lead to an eventual heart attack.
Torkamani and his team at Scripps Research just published this paper about heart disease. They built what he calls a meta-prediction model that uses genomics, current risk factors like cholesterol, age, and blood pressure, and years' worths of a person's electronic health records to predict their risk for a heart attack. It found doing all of this together gives people an individualized prediction of their risk for heart disease over the next 10 years. And it's 2 times as effective as traditional screenings.
If you're an older male, you're essentially going to get a high risk prediction almost no matter what. So the personalization is sort of lacking.
Now that they've built the model, Torkamani tells me the next step is getting doctors to start using it and patients to start acting on the new information.
It's a little bit complicated in that you have to actually get people to respond to this.
Yeah, you could tell them the risk and here, take this statin or eat healthier or get more sleep. Are they actually going to do it is up to them, right?
Yeah, exactly. But I believe anyways, or the motivation that I have is behind this is, I believe as we personalize the risk more and more, that will get people to engage in using that information.
And more information is always a good thing. And the more electronic medical data you have, the more accurate your prediction could be. So make sure you go to your doctor for your regular checkups. The model also uses AI, so it's searched for any other risk factors that Dr. Torkamani didn't put in. He told me that it found poor mental health and lack of sleep were a couple of major red flags that traditionally aren't included in heart assessments. Health issues, medical breakthroughs, just one of the areas I like to cover.